Hi there, I'm Anna Marie De La Vega. Thank you for joining us today. This is Focus, and we're talking today with Fahad Tahir, the president and CEO of Ascension St. Thomas, a nonprofit hospital, by the way. So welcome, first of all, to the show.
Thank you so much for having me, and thank you for having Ascension St. Thomas.
Well, apparently you're doing some great things that people need to know about because it's groundbreaking for healthcare overall. Mm-hmm. You know what I mean? And these are things that people may not realize are available. People may not realize have changed in the past few years. They were like, well, my grandfather went to the hospital and his head fell off or whatever.
Yeah.
But things have changed. And so we want to talk about how hospitals have changed.
That's right.
Through the years. So there's actually a proposed new hospital, Ascension St. Thomas Hospital in Clarksville.
That's right. Clarksville is a fast-growing community with need for an additional hospital so that people don't have to drive all the way into Nashville for some of the care they need.
Mm-hmm. Is there a specific part of the community that's growing faster in Clarksville? Is it younger, older?
Yeah, Clarksville is an amazing community that's been growing for nearly 30% over the last decade and anticipate continued growth over the next 5 years, about 10%. So there's a lot of growth happening in Clarksville. It's a combination of things. Fort Campbell, there's a lot of service families that both live in the community. Their families have care and access needs in the community.
Right.
So it's just an incredible growing community from a standpoint of Fort Campbell and the impact it's had in the region around Clarksville and Montgomery County. Also, there's just an incredible amount of economic development. The elected officials, the community leaders have really been thoughtful about building Clarksville as a destination for large organizations.
Oh, wow.
And there's a lot of new companies that have moved their headquarters, moved their manufacturing, moved their industry to Clarksville and Montgomery County. And so that combination has resulted in Clarksville being among the fastest growing communities in the state, number 5 busiest city in the state.
Wow.
And probably on a trajectory to be the 4th largest city in the state. So with all that, to have a limit of the number of hospitals and access and choice is a challenge for the residents. And so we've served Clarksville and Montgomery County for generations. Ascension St. Thomas is a 127-year-old organization. So we've grown up in the community for generations. We've served a lot of folks over the years. We've served people in Clarksville and in Montgomery County. Often they've had to travel to Nashville to get access to the care they've wanted from Ascension St. Thomas. So we're making that easier, bringing that care closer to home for folks.
Oh, that's good. So 127 years.
That's right. 20 years just right in Clarksville. We've had our first location actually opened 20 years ago, and now we have 14 locations. So this is kind of the hospital is the finishing touch, kind of the cherry on top for an incredible healthcare system that's been built alongside our doctors and physician partners and key leaders in the community.
So why is it important to have multiple locations for people instead of is hospital care kind of spreading out a little bit more these days?
Well, just like as we see in the way folks live and work in the community, there's more and more growth happening across Middle Tennessee. And so we want to make it easier for people to access care locally, close to home. And they should have a choice of who they can access. And if they want to choose an Ascension St. Thomas facility, they shouldn't have to drive all the way into Nashville. They can have that access to care right in Clarksville.
What about surgeries? I noticed that these days, someone goes into the hospital, has a surgery, and goes home the same day.
That's right.
That was unheard of 20 years ago.
Yes, there's been a lot of amazing innovation by great doctors and scientists in order to really bring new clinical innovation to surgery. And so you're right. A lot of surgery is happening in the outpatient same day side. So patients can come in, have their surgery, and go home same day. It's a reflection of great medical innovation, and it's also good planning of doctors taking care of patients. So we have a same day surgery center, an ambulatory surgery center already today in Clarksville.
Oh, wow.
That has served the community in partnership with local physicians in Clarksville. So that has been, and that's one of the 14 locations we already have right there in Clarksville. And our new hospital will have both outpatient surgery, that same day surgery you're describing, as well as complex overnight surgery. We're also going to have cardiac catheterization labs. St. Thomas Heart is the leader in cardiac services, and so we wanted to have cardiac services closer to home. So patients, when they choose Ascension St. Thomas Heart, don't have to travel all the way to Nashville. They can have that choice right there in Clarksville.
Whoa, that's really good.
Yeah.
And it's easier. It's like great innovations through the medical technology and the science and the medicines and all of that, but also for the people. That's a game changer to know I don't have to drive to Nashville from Clarksville or to Clarksville from Nashville just to go to my appointment, to go do this, to go for a checkup, to go for a follow-up, to go for this test or this scan. That is a big life changer.
That's right. Anna Marie, I've talked to some folks. I've had a chance to talk to so many patients, individuals in the community who have been served by our ministry over decades and who've made that choice, driven an hour in each direction to have access to Ascension St. Thomas facility or program. And it's incredible. The trust that we have, we take that trust very seriously. We're very grateful for it, but we want to make it easier for people. We don't want to make them have to make that choice to drive all the way into town. And so part of the way we've thought about it is how do we make it easy? It's going to be off of exit 11. The location that we identified was selected with community input. So we have great recommendations from the community of what's the right location to make it easy to access locally so that we have a lot of community input. I think as a not-for-profit that's been around for a long time, obviously served the community for decades, we have relationships in the community. We have a process we call a community health needs assessment.
Community health needs assessment.
That's right. It's part of being a not-for-profit, faith-based health system. We really value people's input.
Yeah.
And we want to know what folks think, and we integrate that and include that into how we make decisions.
Right.
So what are the biggest needs demographically in the community? Like, the silver tsunami. There's a lot of seniors. What are the unique needs of seniors? The Fort Campbell, military families and the Fort Campbell service families, and also when they retire, 350 individuals retire from Fort Campbell every month. A third of those individuals stay in the community. What are the unique ways that we can serve those families in Clarksville in our new plans for the community? And so there's all these intentional things we want to do alongside the community so that we can make this facility unique and reflect the complexion and identity of what makes Clarksville and Montgomery County what it is.
If you're just joining us, we're talking with Fahad Tahir, the president and CEO of Ascension St. Thomas. I'm Anna Marie, and this is Focus. You said it's a mission.
That's right.
Ascension St. Thomas has a mission, and that mission is what?
We are here to answer God's call to bring health, healing, and hope to all. Health,
healing, and hope.
That's right. So as a not-for-profit, faith-based health system, we have an amazing origin story. It's so cool. I'll tell you really quickly. So, Nashville, we think is growing, and Middle Tennessee is growing as it is today, but that was also true about 127 years ago. So the Bishop of Nashville wrote a letter to sisters asking them, saying, hey, this community is growing so much, we need more access to healthcare. So for these 4 brave sisters traveled across the country to take a house that was donated by the church in order to start what became the first St. Thomas Hospital 127 years ago.
And that's sisters. These are nuns.
That's right. That's right. And these are brave women. I can imagine them to be about 4 feet 10 inches tall, tough as nails, traveling across the country. They weren't driving, as you know, in 1898.
Oh,
so they're traveling.
Like what?
Horse and buggy, I guess.
Oh my gosh, yeah.
But they were braving all that multi-state travel to get to Nashville to enter a donated home to start the first St. Thomas Hospital. And now, generations later, as Nashville and Middle Tennessee have grown, we've grown with the community. 18 hospitals, 320 locations across the region.
Whoa.
We serve in 45 counties in Tennessee, 68 counties, including Kentucky and Alabama. So we have folks choosing us from across the region. It all started with those incredible women with a very purposeful mission that we get to inherit and continue today.
Since it is a nonprofit, you just treat people for free?
Well, we get an opportunity to serve patients. We charge for those services, and the revenue that's generated allows us to reinvest back in programs, facilities, and people.
Okay.
And so healthcare is a complicated business. We, of course, want to make it simpler for patients, and we want to do it the right way. So we want to create geographic access, so bring care locally, close to home. We want to do it in a clinically excellent way. More patients choose us for surgery, births, complex heart care than any other health system. We want to be excellent. We want people with a choice to choose us. We want to make that care local, and we want to make it more affordable. So we partner with health insurance plans and employers to make healthcare more affordable for folks as well.
Good.
And that's part of the vision for our care in Clarksville. We want to bring that great St. Thomas care that folks have trusted over all these decades and generations to Clarksville right there off of exit 11.
I love that. So what about the difference in, like, if the new hospital in Clarksville?
That's right.
How will that be different from an older facility, like if you could look at an older facility and go, well, if we knew then what we know now, we would have done this to that older facility. In what kind of ways will this hospital be different?
We've prioritized, one, we feel so lucky to be part of a comprehensive health system here with multiple hospitals. We get to innovate and design and learn from other facilities we've designed both locally and across the country. But specifically in Nashville, we opened our Ascension St. Midtown facility just a few years ago with a big additional surgery and critical care tower. That opened just about 2021 and 2022.
Right.
And we later opened a women's hospital on the Midtown campus. That's the former Baptist hospital that's now St. Thomas Midtown that people may be familiar with. And so because we designed that facility from scratch alongside physician and nurse input, we had a patient family experience committee that allowed us to get input from our caregivers, of course, but also from patients and families. And so that became part of the fabric of us as a not-for-profit working with the community to get input, but also bringing the best technology and innovation that's known today about a modern facility. We brought that to life at that Midtown facility. So likewise, we see this opportunity to build a new facility in Clarksville in 2025 with the best thinking and innovation to make it really easy to access, modern, comfortable, not just thinking about the patients, also the caregivers and also the families, right? We want to think about where are you going to be sitting in the room when you're with your loved one?
Yes.
So we really try to think about a holistic approach. And part of our faith-based orientation is not just taking care about the medical needs of an individual. We want to think about them as a whole person. And so that means what do you need, body, mind, and spirit? What does your family need? How do you make this a true experience that changes your life and allows you to feel inspired to do good for others?
Wow. Well, what kind of changes then? Give me some specifics.
That's right. It's so cool. So, operating rooms are different today than they were a few years ago. Now we have a lot of advanced technology, robotics, and imaging in surgery. So often in the past, we might have relied on the skill of a surgeon and that surgical team that's in the room. And that's still an essential part of what makes great surgeries and great clinical programs at St. Thomas successful. But we try to now invest in and surround those amazing surgeons, surgical teams with clinical and technological innovations. We have advanced robotics and imaging equipment right there in that room. As you can imagine, that room can get a little crowded. So the rooms are a lot bigger today, bringing in all this new technology that may not have been there a generation ago.
Oh, wow.
So that's an example. When we were designing our inpatient rooms, so the rooms where hospitalizations are, where there's a bed and a family waiting area, we did that in Midtown during the pandemic. So we learned a lot about some of the infection prevention guidelines and best practices.
Yep.
So as a result, we've designed a very thoughtful, sensitive environment to how to make sure we protect our patients and community members in the way we design our spaces to isolate rooms and make sure patients have privacy and have a layout that's informed by infection prevention so that disease doesn't spread.
Whoa.
These are kind of two very tangible examples of how innovation today is very different than it was a decade or generation ago because it's a combination of technology, but also the best architecture and design thinking known to science.
What makes it the best architecture and design? Just the space layout?
The way you lay it out, how families and individuals can flow, how the room is laid out to be efficient for the caregivers so that the caregivers can access the patient very effectively. We also try to be thoughtful about not just how hospitals work, but how does life work? And so when we think about designing the design principles in our facilities, we think about how to make it a very safe and efficient care experience for the individual, family, and the doctors and nurses who are taking care of that patient. But we also try to think about what are the best design principles in other aspects of your life. How does the waiting area reflect the best comforts of a comfortable family waiting area?
Right.
In other aspects outside of a traditional hospital setting. So we really try to be intentional about integrating all these things. So when we look at the hospital in Clarksville, it's going to have great local access. It's going to be easy to come into so that the campus interior and exterior layout have been very thoughtfully contemplated. We don't want to have a lot of steps for an individual to get from their car to the front desk.
Right.
We want them to see a warm person immediately. So that whole design principle of how to make it a warm human experience that's very compatible with us seeing you as a person, not just a disease, but as a whole person.
Yeah.
It's part of our faith-based, not-for-profit health system values.
That way you don't have that older person walking and walking and walking, and then coming in the door, realizing it's the wrong door, but
That's
coming
right.
in the door and doing that standing and looking around like, now where do I go?
That's right.
What do I do? Where am I supposed to be? And having to track someone down.
That's right. And we just want to make it easy for people. We want to make it easy to access, convenient. You think about the individuals that are coming to a hospital. They obviously have healthcare needs, right? So we don't want to add to that burden by adding anxiety because it's confusing.
Yeah.
We don't want to add stress because it's a long walk and you're not physically feeling like you can make that long walk. So we want to be really thoughtful in how we design it, and then also we want to have the amenities for your family so that you also don't have to worry about your family member.
Like what?
Well, just the experience of how the waiting areas feel while you're waiting for your loved one, how the room furniture is laid out, not just the bed that a patient is on, but also the guest spaces for family members who are there with their family and maybe staying overnight.
Yeah.
Those are the kinds of touches, I think, that can really personalize an experience.
Yeah.
And then when we think about the interior design, we want it to have a warmth, and healing is multidimensional. There's a body, mind, and spirit component of it. So we want to be great at the medicine, and we're known for that.
Yeah.
And that's why people choose us for all the most complex heart conditions, surgical conditions, and to deliver a baby. People choose us because they know what they're getting with St. Thomas. But we also want to think about that whole person and the experience around that medical care is also thinking about how their family is feeling while they're waiting for you to get the results.
Yeah.
How are you feeling walking in and out of different clinical spaces when you're traveling in to have your service? Is it easy to come off the freeway and access the facility?
Yeah.
So we've tried to be intentional about all of those things. The good thing is it starts by listening. When you talk to the community, when you listen to community leaders, elected officials, physicians, patients, and hear those stories, that often is the roadmap for how to do it right for patients and for the community.
If you're just joining us, this is Fahad Tahir, President and CEO of Ascension St. Thomas. And one of the things that makes Ascension St. Thomas different is that it is nonprofit.
That's right.
And the focus on the community and the focus on people, as well as the latest technology, surgeons, staff. Is there a nursing shortage still?
Well, the country as a whole has a shortage of healthcare workers and nurses. You're right about that. Part of how we work through that is in partnership with the incredible local universities that we have across Middle Tennessee, including Austin P and Clarksville. But of course, there's universities across the region that are providing incredible, thoughtful work, expanding nursing programs and other healthcare programs in order to keep up. So Middle Tennessee is lucky. We have great collaboration between the universities, the healthcare systems, and the business community. We have elected officials that believe in and support a growing workforce to meet the community's need.
Whoa.
And we have growing programs.
So that's
Hey, by the way, folks don't mind traveling in to get trained and become a nurse here in Nashville. So people from all over the country choose the universities and the Ascension St. Thomas facilities to provide care because it's a great place to live. It's a great place to raise a family. And of course, we've got great people we get to serve every day.
So as well as the proposed new facility in Clarksville, I read that you're going to do some remodeling on some of the other hospitals that have been around a little longer. Tell me the kitchen story. Wasn't there a hospital that was designed and built years and years ago, but it didn't have a kitchen?
I have heard that story. I had thought about it a long time. I love that you know that story.
I was coached a little bit.
Well, I got to tell you, hospitals have come a long way over the years, just as you said, Anna Marie. And I think, part of what we've realized over time is we want to continue to invest in communities across Middle Tennessee. We can see where there's demographic growth, and we want to make it easier for people to access care locally. So we've made a lot of investments in growing access points, like in Clarksville, the conversation we're having today, or in Murfreesboro, where we have invested more than $600 million over 15 years in Murfreesboro and in Rutherford County to bring access to a world-class hospital and many sites of care across the county. Like that spirit, part of what we want to do is bring access locally, but also reinvest in our facilities. We want to modernize and innovate in the existing facilities we have.
Yes.
We've built our trust and relationships with this community over decades, and these facilities deserve modernization and a great patient experience. A lot of the design principles we just talked about.
Yeah.
So we're bringing that same thinking to our signature facilities in Nashville that people often recognize us for: Ascension St. Thomas Midtown at 2000 Church Street and Ascension St. Thomas West on Harding Road. So those facilities have a historic identity of being the Nashville hospitals. We've been trusted by Nashville for generations, and we are so grateful for that trust, and we want to reinvest back in those facilities to modernize them, to ensure that they have the best innovation, technology, and patient and family experience that we just talked about. And so we're excited to make those investments. That includes best clinical equipment that's known today, along with a great experience for the families that are there. And we'll continue to ensure that we invest in all of our facilities across Middle Tennessee. We have 6 rural hospitals across Middle Tennessee. We take our responsibility to serve rural communities very seriously. That is part of our not-for-profit mission. We are grateful for the trust that those communities have had, and we have brought access to care for those communities. And so when we say we want the best clinical equipment, that also means ensuring that we commit to and invest in our rural facilities as well.
Oh, that's good. And so we don't just leave people hanging. The microwave story was that originally there was a hospital that was designed with just microwaves in it or something like that, no kitchen. But as the hospitals grow to meet the needs, the changing needs of patients and their families.
That's right.
We get kitchens and we get food.
That's right.
So I think that's fantastic.
It's so cool that you know that story.
What about the silver tsunami, I've heard it called? The aging population becoming a big, big chunk of our population, and often with very intense medical needs, often with a lot of medical needs.
Yeah. Well, I think as Middle Tennessee is a great place to live and raise a family. So we have a lot of families coming here. We also have a lot of grandparents coming here, and a lot of seniors choosing to retire here because it's a great place to live. And for all the other amenities that we know. So there is a incredible amount of growth that's happening in Middle Tennessee, especially with seniors. So while demographically our entire country is facing a silver tsunami, an exponential growth in seniors at a higher rate than the rest of the subpopulations, that's especially true in Middle Tennessee. And so as a result, we have to be very mindful that seniors often have more needs for healthcare than a typical younger family, and different needs in healthcare. So our mix of services has to be informed by how to serve the growing senior population. So whereas in a community that has a younger population, we might have more family medicine and obstetrics and maternity care, and where, the services are more around sports medicine, we might focus on different subspecialties and services that are more around neurological care and advanced cardiology, and services that are more often needed among the senior population. And so we try to be mindful of listening to the community through those community health needs assessment, looking at the data along with state officials. There's a lot of great data on the common disease prevalence, the common healthcare needs of a community. And then when we look at that coupled with the aging, we really try to design a healthcare system for each community across Middle Tennessee that reflects the unique needs of that population. So if a community has a lot of seniors, we want to be very mindful of the specialties we put in those facilities being oriented to that community's needs. Clarksville is an interesting community because it has both a lot of young people because of the Fort Campbell influence and because of the great new businesses that are coming, $5 billion in economic development that the local elected officials and chamber and economic development councils have been able to lead. That has drawn a lot of new large businesses. And so as a result, it's a lot of young families that have come to work and serve in Clarksville and Montgomery County. But there's also a lot of seniors. And so we have been really mindful of how to make sure our service mix is informed by the demographics of Clarksville and Montgomery County. We do the same thing in partnership with local communities across Middle Tennessee.
Wow. Could I, as a community member, mention 2 quick things?
Love to.
For seniors?
Yes.
Tiny print and portals, online portals that sometimes they have trouble navigating and sometimes have trouble reading.
That's great feedback. And can I give you one other insight that we've learned? There's a geriatric certification for emergency departments, which allows you to design the design principles of an emergency department specifically for senior population. It's a specialty certification. We actually incorporated that into our new Ascension St. Thomas West Hospital ER renovation. So in partnership with the community, we just completed a $10 million renovation at Ascension St. Thomas West. We're really excited about it. And when we were designing, we were like, what are the things that we can do to make it a better experience for individuals and families? And at that facility, we take care of a lot of seniors with some of the most medically complex conditions. And so we wanted to bring a geriatric certification. I believe it's the only one in the state. So we followed all of those design principles to bring that geriatric certified ER emergency room model to the Ascension St. Thomas West facility, which will be opening this summer. So we're excited to learn from that first facility. And as you said, we're always innovating, always looking at the best design principles, always looking at what's out there, and we'll take those principles and then apply it to future design across Middle Tennessee. We have a lot of facilities across. We can learn from each other and continue to expand access to world-class care.
That's fantastic. I've noticed a standalone emergency locations.
That's right.
Right? Tell me a little more about that, please.
Well, we have... the way we think about bringing access to care to communities is we want to provide care at all stages of life. So we have partners, physicians, primary care, specialty care, urgent care. So we have a lot of different types of access. We have physical therapy. So we have 320 locations across Middle Tennessee. That includes freestanding emergency departments. It includes outpatient centers, ambulatory centers, that same-day surgery that you mentioned earlier, along with these big hospitals that are often known and get a lot of the attention. But there's a lot of access points that we have that are there for same-day care and immediate needs closer to home.
Well, unfortunately, we're out of time. This has been great information. Do you have anything else you'd like to add before we wrap up today? Unfortunately, we're almost out of time. So is there anything else you would like to add that our listeners need to know?
Well, thanks so much for the service you provide. And just, healthcare is such an essential part of the fabric of our communities and our families. So prioritize your health, your family's health. Be an advocate for your own health and your family's health. Choose a personal physician and really make healthcare part of the important decisions you make for yourself and your family. And if you need access to care, know that Ascension St. Thomas is close by.
Perfect. Thank you.
Thank you.
Fahad Tahir, President and CEO of Ascension St. Thomas. We'll put some more links on the Focus Facebook page so you can find out more. Please join us again next week. I'm Anna Marie. That's Focus.